Every flu season, people are looking for natural strategies to either prevent the flu or recover faster from the flu. Conventional medicine offers Tamiflu and other medications to try and help with that, but they don't really help. If you look at the research on Tamiflu, for instance, the insert says it may decrease your symptoms by a day, day and a half, versus if you didn't take it at all. That's hardly worth the side effect risk. And people on social media will argue that there aren't natural strategies to boost the immune system or help you help flu, or in our current environment, help you fight coronavirus. And that just is not true. Those people have not read the research. There are piles of research indicating natural strategies like vitamins that support the antiviral immune response and help fight, prevent, clear infection. And today I want to look specifically at the vitamin C research and help you understand that. I also want to cover the question that I get commonly, which is how much vitamin C can I take? What is safe? What kind? Etc. So let's dive in. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. When battling infection, whether it's bacterial or viral, whether it's flu or coronavirus, vitamin C has been proven to augment the antiviral and anti-infection arm or capacities of the immune system. It's in the research. There's been piles of it done. So when you see on social media where people are saying vitamin C is useless, nutrients, vitamins are useless, supplements are useless for these things, they are ignorant to the facts. And they're probably just promoting a pro-pharma paradigm. But what I want to cover is that there are piles of facts, and let's dive into how vitamin C augments the anti-infection side of the immune system, helps you prevent infection and cancer as well, and helps you recover from it if you do get infected. Now, I broke it down into 3 different areas. We want to look at how vitamin C helps the immune system against infection as a whole, how it specifically helps versus bacterial infections, and how it helps versus viral infections. And some of the things that it does from the anti-infection standpoint apply to anti-cancer as well. So, in general, what vitamin C does for the immune system is it increases the number of circulating lymphocytes. And lymphocytes is a fancy term for white blood cells, but specifically it's promoting T cells. And T cells, whether CD4 or CD8 T cells, function in differentiation and promoting antiviral defenses. Okay? Now, it also promotes T cell life, or another way to say that is it increases the T cell resistance to death. So basically, vitamin C helps your T cells live longer and do their job longer and more efficiently. So if your T cells are going to live longer, they're going and resist death better, they're going to be better soldiers, better fighters, right? And then vitamin C also decreases what's called Th17 and Th2 cells. What the heck does that mean? Well, your adaptive immune system is made up of T cells and B cells. That's like the SWAT team, whereas your innate immune system are the local police. So if you have an infection, initially the innate immune system responds first, the local police. They go attack, they try and clean it up. They'll take samples of the damaged tissue to the lymph node and present it to the adaptive immune cells, naive T cells and B cells. Those naive T cells and B cells, when they get the sample, they can then mature from naive or immature or babies, say, picture that, they can then mature into adults. And when they're maturing, that's called differentiation. And a naive T cell can differentiate into one of any number of adults. Or think of it, it could mature into one of any number of professions, okay? There's Th1, there's Th2, there's Th17, there's Th9, there's Th22, there's T follicular helper cells, there's Tregs, there's lots, okay? So which one it differentiates into depends on the signals given to it by the innate immune cells, as well as the microenvironment and the nutrition and the milieu around it, okay? So when you have sufficient levels of vitamin C, that's going to promote a Th1 response, which the Th1 response is the response that deals with intracellular infections. So if you have a bacterial infection in your cell, or you have a viral infection in your cell, and all viral infections are going to be in your cell, then you want a Th1 response. You don't want a Th17 response or a Th2 response to be the dominant response. If Th2 is the dominant response, that's inhibiting your Th1 response, so it's making you worse at fighting that virus. And if Th17 is dominant, it's also inhibiting the Th1 response. So we want Th1, not these two, to be dominating during a viral response or an antiviral response. That's what vitamin C does. It suppresses the ones that would inhibit the Th1 response, and it promotes the Th1 response. So when we're talking about the specific responses or specific impact of vitamin C on bacterial infection, the first thing it does is it increases what's called chemotaxis. And chemotaxis is a fancy word. You could break it down into chemo and taxis. And chemo is basically chemical, or when there's damage in the tissue, the cells are going to release chemicals called cytokines that call the immune system to the area to say, hey, I'm hurt. So the chemicals are going to call the immune system to come in on their taxis, is a way you could remember it. They're drawing the immune system to the area to clean it up, to fight it, to clear it. So vitamin C in the bacterial infection increases chemotaxis, or helps call the immune system to the area to clean it up and prevent the infection from spreading even worse, right? The vitamin C is a required nutrient for proper phagocytic bactericidal activity. What does that mean? So it's required for, and I'll abbreviate here, proper phagocytic bactericidal activity. Phagocyte is a fancy term for white blood cells, and what they do, phagocytes come in, and if this is a bacteria in the tissue, or inside your cell, the white blood cell is going to come and engulf or phagocytize or eat the infected cell. If we go eat the infected cells, once we've eaten all of them, the infection's gone and we're safe. So vitamin C is going to increase your white blood cell or your immune system's ability to go in and eat the infected cells, get rid of them, stop the infection. Lastly, in the bacterial response, the vitamin C is going to increase Th1. And like we just said a moment ago, Th1 is the immune response that increases when you want to deal with intracellular infection, whether that's bacterial or viral. It increases the eating of the infected cells so that it doesn't spread. Now, from a viral infectious standpoint, vitamin C enhances, let me change colors here. It enhances natural killer cell expansion. What are natural killer cells? It's right in the name. There are killers. There are immune assassins. Natural killer cells are our best viral killers. They're our best tumor cell killers, or our best anti-cancer cells. So in the context of a viral infection, whether it's H1N1 flu, whether it's coronavirus, whether it's any virus you're talking about, the natural killer cells are key players for our immune system. So vitamin C's ability to increase natural killer cell expansion says, hey, when we have sufficient vitamin C, our assassins can clone out. We have more of them, and we're more effective at killing that tumor cell or killing that coronavirus or that flu. Vitamin C also increases natural killer cell mediated killing. So not only does the vitamin C help your natural killer cell army increase, but it also makes them more deadly or more lethal. They're better at their job. They're better snipers. So having sufficient vitamin C is going to be key in having enough soldiers and having the soldiers be well trained and deadly. Vitamin C in context of a viral infection increases CTLs. And CTL stands for cytotoxic T lymphocyte, or CD8 cells. Cytotoxic T lymphocytes are you could imagine it as the T cell version of the natural killer cells. Okay, so it's just another group of assassins, a different group than the natural killer cells, but just as deadly. In a viral infection, in a cancer response, we want both of these cells to be as robust as possible. And for that to happen, we want to have optimal vitamin C levels. And then lastly, recently, 2016, there was a study done looking at natural killer cells and their role against H1N1 flu, influenza A. And what the study found is that the natural killer cells, and when you apply vitamin C, the vitamin C decreased the lytic cycle of the virus. So decreased the lytic cycle of the virus, and I'll explain what this means in a moment. It decreased lung inflammation in the patients with H1N1 flu, and it increased the survival rate of those patients with H1N1 flu. So this study, which was in the Journal of Pharmacy and Pharmacology, looked at using vitamin C in H1N1 influenza A patients, so flu virus patients that had lung inflammation and had potential severe cases, maybe needing respirators, similar to what we're seeing in our world now, just a different virus. And vitamin C applied in that context decreased the lytic cycle of the infection. What does that mean? The lytic cycle of the virus, when the virus is lytically active, it's actively hijacking your cells and the cellular machinery to replicate itself and spread. So the vitamin C in this study was shown to decrease the lytic cycle of the virus, meaning it was decreasing its replication ability, decreasing its ability to spread. That's good if we're trying to get our hands around a pandemic, right? Vitamin C decreased the lung inflammation in the H1N1 patients. More lung inflammation equals higher chance of severe case, higher chance on a respirator, higher chance to pass away. So decreased lung inflammation is a huge goal in H1N1, and in our current situation, it's a huge goal with coronavirus. Vitamin C has been proven to do that in the flu context. It's likely that it's doing that in the coronavirus context as well. We don't have those studies, but it's not a far jump, okay? And lastly, what's most important to everyone in the world is vitamin C increased survivability in the patients with H1N1. So the vitamin C directly affected fatality rate and mortality rate in a positive way. So what does this mean? This means that vitamin C, there's tons of science behind vitamin C being crucial in your response to infection and your survivability in infection, specifically in flu. So is it useful? I hope by now you can say yes. How much should you take? Well, currently in the coronavirus environment, there are doctors in New York City, there's doctors in China, there's doctors all over the world using vitamin C to help save those severe cases. One doctor in New York City with all his severe cases is using IV vitamin C at 1,500 milligrams a couple times a day per patient. Now, obviously, if you're watching this on YouTube, you're not severe, you're not on a respirator, you may not need that dosing. You should work with your clinician to figure out what works for you. You probably won't have access to IV vitamin C as well because that's not as available to the consumer as it is in a hospital, but you don't necessarily need IV vitamin C if you're not a severe case. So what can you do? You can take supplemental forms. You can do powder, you can do capsules, you can do liposomal. The difference between the three is potential absorption differences, but the real key in taking it, what the research says, is you want sufficient levels in the blood. Sufficient plasma levels of a sorbate correlate with sufficient intracellular levels, which promotes optimal response. So me personally, well, I'll get to that in a moment. The answer to how much is enough. You're really safe taking vitamin C. Whereas Tamiflu and medications have high side effects and adverse effect risks, vitamin C has very little. The major person who is at risk is someone who has iron overload or hereditary hemochromatosis. You're on that iron overload spectrum. So if that's you, you don't want to do high-dose vitamin C. But if that's not you, you're probably safe. And the worst thing that's going to happen to you is a bowel tolerance response or diarrhea. Basically what happens is if you take too much, you're going to quickly have diarrhea and you realize, wow, that was too much. So for me personally, and I'm not connected to this company at all other than I purchase things from them, but I use Biotics mixed sorbate powder. I like the powder because I can titrate the dose to whatever I want. If it's a capsule, it's harder to do. So one teaspoon of this is 2.8 grams of vitamin C. For me, that causes diarrhea. So my bowel tolerance is somewhere below that. What I found for myself is 1.4 gram doses works fine. So I just divide that in half. I don't have diarrhea, and I can do that throughout the day as many times as I want. So that's me. You'll have to figure out what's right for you, but keeping those vitamin C levels up and optimal is going to maximize all of these findings in whatever context of infection we're talking about. So I hope this helps you. I hope that this helps you understand that you're not hopeless as you're waiting for the magic vaccine that's not going to come. If you're waiting for the magic drug that's not going to come, the magic is in consistent application of principles, the principles of health, diet, physical activity, stress reduction, sleep, healthy relationships, and supplements when needed to optimize blood levels, to optimize immune response in this context. So I'm Dr. John Bartemus. I hope this was helpful for you. If you're looking for a clinician that understands these things and can help you achieve and maintain optimal health, reach out.